Hi, I'm Dr. Jeffrey Annamarino from Bellissimo Plastic Surgery and Medi Spa. Welcome to our live Facebook event. Every month we try to pick a topic that is educational and hot topics that our patients are asking about. So tonight we picked dermaplaning, and so joining me tonight is Tara, our wonderful esthetician, and she's going to be working on no other than Lizz Venenzi, who is a member of our social media team. And Lizz has not been through anything like this before, and so tonight we're going to have Tara talking about and demonstrating a dermaplaning treatment. So let's get started, and Tara's already underway. She's already done some microdermabrasion just to sort of get the skin ready for the dermaplaning. So tell us what you're doing.
Okay, so dermaplaning is a form of resurfacing. So what that means is deeper exfoliation, a little bit deeper than you can at home. And basically it's a form of resurfacing that helps with texture, fine lines and wrinkles, pore size. Dead skin turns to dirt, so when we remove that, we can clean out the pores.
Good. So basically what happens, especially in the winter with the wind damage and in the summer with the sun damage, the outer layer of your skin starts to get thicker and kind of ball up. So this way, Tara can take all of that tissue off and just basically shave it down. And I don't know if you can see it, but you can see just some of the little fine hair and some of the outer skin that's being shaved off. The nice thing about it, the texture afterwards is very smooth. We were talking about before, lots of ladies like it because their makeup goes on much smoother afterwards.
Is it painful?
No, not at all.
It's relaxing.
Yeah, I was kind of worried, but it's definitely not painful.
It kind of feels good because it feels like you can feel, all that buildup on your skin come off.
Yeah, that's
That uneven texture we feel.
Who is a good candidate for dermaplaning?
Really anyone except for if you have active acne, then I would suggest a chemical peel because we would open up the acne and we don't want to do that. So really anybody could get this done. Typically I tell people to get this done every 6 to 8 weeks for best results. We provide a facial with this. I also provide a light chemical peel after this, and that works really well with tightening pores at the same time.
How is dermaplaning different than a peel?
Well, a peel is an acid, and the idea behind that is burning the top layer of skin so then it sheds off after. This I'm actually have a tool that I'm taking it off manually.
All right, so I guess the idea, that the take-home message is that if we really want to get a little bit deeper with a peel, then doing a dermaplaning before that can shed off that dead layer. So that allows your other moisturizers, the retin-A's, the chemical peels to actually penetrate a little bit deeper and really go to the target areas. Otherwise, it'd sort of be held up by that layer of dead tissue. So this is actually going to facilitate the other products that you're using and help them work at their best as well.
I have a question I hear a lot. Will my facial hair grow back thicker and darker since you're removing it?
No, because we're only on the top layer of skin. Our hair follicle actually goes deeper in the layers of skin, and we aren't affecting the bottom of the follicle, so it will come in.
I think that was an old wives' tale that
Yeah.
moms had when they had with kids, and they would get their hair cut, or shave their heads to get it to come in thicker. I'm not sure how that started, but yeah, it definitely is a myth.
If I have an event coming up, is dermaplaning a good option for making my skin look better?
Absolutely, because you're going to feel the result right away. So if you have an event coming up, I usually typically say that day or the day before.
What about like a wedding?
So the day before would be great because I know brides are really busy that day or in the evening, the day before. So that, the morning before would be great, I think.
Would you recommend sessions of dermaplaning before a wedding or a big event, or would one suffice to have a really good result?
Well, like I said, for best results, I suggest every 6 to 8 weeks, and then you'll see improvements in your skin. It'll just get better and better. So, but even if you just had one, your makeup would go on really nice. So brides would like that in itself. But the more you have, the better.
Right, so I guess another message for it is there's really not a lot of downtime or any downtime with it. I mean, realistically, afterwards, your skin might be a little bit red, but it would only last maybe several minutes because it is very superficial. And then adding the other processes to it, you might be more red from the chemical peel if you choose to do that, but not from the dermaplaning. So there's really no downtime, am I right?
Right.
What all does a 60-minute session of dermaplaning include?
Like I said, I do 2 different ways. So you can purchase the Dermaplane, and it's just the Dermaplane. I cleanse you, perform the Dermaplane, and then a little massage with some hydrating moisture, and that's like our lunchtime Dermaplane. Or there's one where there's a full facial included, and like I said, microdermabrasion. I'll run 1 pass of that. I'll perform the dermaplaning, and if your skin still looks okay and isn't irritated, then I'll go ahead and put a light chemical peel on there. You get a face massage, a hand massage, a mask. It's wonderful.
It is pretty nice.
Yeah.
Yeah.
Now, can you put makeup on after you're done with the treatment? Can they walk out and go back to
Absolutely.
work and put makeup on?
So
How does
no, she's going through the entire face. She'll come down over the forehead, up in the temporal areas, just on the bridge of the nose, and along the chin, the neck. So all of that skin is now revitalized. I'm sorry, I interrupted your question.
Liz, do you have any questions?
She's a little busy right now.
Here, we'll do this side of your face. So we can talk.
I was wondering, so I'm like pretty terrible at keeping up with my skincare. So after this, should I be moisturizing, or do you have recommendations for me, like in the interim until my next dermaplaning treatment, to take care of my skin?
Well, after this, I normally tell you not to use any retinoids or anything for about 48 hours. And then you can resume to your normal skincare. But do you mean you want to know what's the best skincare for your skin?
Yeah, kind of, I guess. What's a retinoid, first of all?
Okay. So a retinoid is actually, it's retin A, and it's vitamin A, and it stimulates collagen. So it has the ability to penetrate down to the collagen cell and stimulate it for anti-aging. So anyone over the age of 26, I always suggest, should be on that.
Oh, okay.
That's something you do at night.
Okay,
Uh-huh.
thank you. I had no idea.
Yeah.
Great.
So now, going into what Liz was talking about, so somebody comes in, you really start assessing their skin, what they need. But at this point, we talk about taking care of your skin like going to the gym. You have to sort of keep it up. It's not just
Sure.
coming in, working out really hard, and then feeling like you can do just about anything. So you have to keep your skin in tone. So you usually put them on a skincare line, add in the retin A, depending upon the age, and to keep the results going, correct?
Sure. I'll consult with you during this process and basically customize whatever skincare I feel would probably be best for you. You know, we can start with just a little bit and incorporate it, or you can, decide to purchase whatever products to add to your regimen. Absolutely.
Great.
Right. So this can be your lead-in to, if you're not on a system or a skincare line at all, or a regimen yet. I mean, you can actually start this process and have Tara or somebody like Tara start toning up your skin right away, and this would be a lead-in to exfoliating it, that first step, and then continue with the skincare line. And then, as Tara said, probably every 6 to 8 weeks, you can come back and do more dermaplaning and keep that outer layer of skin as thin as possible. And that's when you're going to get that glow, that shine to your skin. When that layer builds up, that's when a lot of people come in, they start to look a little sallow. They've lost that brightness to their skin, and so this is all in to keep up with that. Also, if you're in between, if you do suffer from acne, this would help try to keep some of that outer layer from blocking pores, and the products that you're using to help keep the bacteria down will allow them to penetrate even deeper as well.
Now, do you have patients come, you offer a complimentary consultation?
Oh, yes, absolutely.
And what do you do in the consultation?
Well, normally I just, they come in, fill out some paperwork to let me know what they're already on or their regimen already, and then we just sit and just discuss their needs and corrections and what's bothering their skin, and then I come up with a plan for them.
I have a question about that. So I read up about all of the different Medi Spa treatments, and some of them I'm like, oh, that sounds so cool, I want that. But if I were to come in for a consultation and I say I really wanted microneedling and you didn't recommend that for my skin, you recommended a different treatment, would you tell me that?
Oh, absolutely, yes.
Good.
Yeah. Yes.
We just give you a laundry list.
Yes, yes.
And would you not, I mean, if the treatment changes as you are maturing and your skin is changing, you would just take them through the different steps of what would be best for their skincare.
Right. Yes.
So it depends on their age. It depends on gender, actually, because male skin is a little bit thicker. I mean, technically, we men do this just about every day when we shave our face, so we're already dermaplaning every day. But and as you said, different stages of your life, you may need different products, and so having somebody like Tara, who can keep assessing your skin, things that you're on in your early or to late 20s and into your early 30s may change as you start marching through your 30s and into your 40s. So that process may change.
Especially lifestyle, because not everybody can have downtime, and we do have treatments where you do have downtime and some that you don't. The ones with downtime, of course, you may see a result faster, but we also can start you on things that do not have downtime and get you there with some maintenance.
So this takes off the peach fuzz on the face, so what would the difference between getting this treatment versus like a waxing to remove the facial hair?
I can tell you this is probably going to be a lot less painful than waxing.
Sure.
I don't know why. I don't know how women can tolerate that.
Yeah.
But,
But waxing, basically, you're putting wax on, you're pulling off, so it's pulling from the root, and there's always a chance of your hair coming back in thicker, actually, when you wax.
Really?
Yeah, because you are stimulating that follicle at the bottom, and you're causing, if there's a sac of blood inside your hair follicle, and it's called a papilla, and that's what your hair eats and nourishes from. So when you pull a hair out, it actually fills up with more blood and has more food to eat, so it gets thicker and deeply rooted.
And if you're using specific products like retinoid, then when you have to be careful with waxing, correct?
Correct.
yeah. The other thing is this is a nice procedure for any skin color, any skin tone, because it's so superficial. So you don't have to worry about darker skin, scarring, or anything along those lines. So anybody that has those deeper tones, skin tones, is not an issue. And you can do this all year round as well. So there's certain things that it's hard to do sometimes with the laser when there's a tan. If you're trying to do hair reduction when you have a tan, it's not recommended to do the laser. But this process you can do at any time year round.
Riley says hello, Tara.
Oh, hello.
How long has like dermaplaning been around as
Since
a
men
treatment?
have been shaving. I'm not sure when it became popular a while
long
ago.
time.
Yeah.
I think I saw the Kardashians. Kim Kardashian gets dermaplaning, and that's when I first
I bet she does. That's
Is
why
it one
her
of your
skin
more
looks so good.
popular procedures you see?
It really, yes, this is one of the biggest ones that I do all the time because the result is so nice, it's smooth, you'll feel the result right away. Everybody loves it.
Yeah, and I mean, you have nice, healthy, young skin anyway, but honestly, when you can see the difference just sitting here, you can see how much smoother the skin is.
This is gonna give her that dewy, glowy look right away.
Ooh.
So for the remaining 2 days of the month, we have a special still running.
Yeah, so we're getting to the final 2 days, so a lot of the specials are listed on the website, but you can purchase a dermaplaning treatment for $100, and you get some hydrating chocolate
Strawberry facial.
strawberry
treatment.
facial. I was trying to remember all of that. These ladies come up with these crazy names, and they escape me. So
And what does that do for you, Tara?
The chocolate strawberry facial, it has some firming properties to it, also very hydrating. It's an antioxidant, so it's nice. It's just very hydrating and soothing. So it works really well after this procedure.
We're going to move in close so we can get a close-up of her face.
Hi, everybody.
You want to do this side, Tara?
Tara, I do have one quick question.
Sure.
So when would you recommend a chemical peel following a dermaplaning treatment?
Well, we could perform a mild chemical peel right after this.
is there
But-
a certain person you're looking for that would benefit more
You
than
know
others,
what?
or just about anybody?
To be honest, almost everybody gets the chemical peel just because it's so nice and it's so light. But if right now she looks good, if she looked really red and rosy, I wouldn't. But right now, what I'm seeing of you, we could definitely do that on you. But a more intense chemical peel, I would probably wait about 2 weeks or so.
What does a chemical peel do for your skin exactly? I know you mentioned it burns off the top layer.
Yeah, so chemical peel is a form of resurfacing along with dermaplaning, microdermabrasion, it's microneedling, and what that means is a deeper exfoliation, taking the dead skin off. So chemical peels, we have a little bit more, because there's so many different percentages and things like that, we can control it a little bit more, meaning no downtime versus downtime. And we have so many different ones available, so it just depends on what you're coming in to look for and what your skin needs.
Great.
Yeah.
Yep, the deeper the chemical peel penetrates, the more results you have. But you also have more downtime because your skin will be more reactive to it and more inflamed. So, depending upon what your goals are and what kind of condition your skin is in, then Tara would talk to you about that, and then you can kind of plan getting back to work and activities that are coming up.
Yeah, so when you say downtime, do you mean like no makeup downtime or days off from work? And if so, how many? I guess for your most often treatment of chemical peel specifically.
So the more intense chemical peels, it depends, but typically you have a powdery flakiness for about 4 or 5 days, but you do have to be very careful what you use. The day of a chemical peel though, you cannot wear any makeup. You can wear eye makeup or lipstick, but that's all. The day after, you can go ahead and incorporate your makeup again if your skin feels okay. You have to use your judgment, of course.
Got it.
But I would give it a good week from the flaking, and day 6 you're glowing.
And that would be part of the consultation too. Depending upon the peel that you want and the procedures, then that would be all kind of factored in and discussed so that you knew if it was the right time for you to do it.
Oh my gosh. Woo.
So you're finishing off
So,
with
with the mild peel, because her skin looks fine, she's able to get this peel. And what this peel is going to do is it's going to make the dermaplane go a little farther, plus it's going to really target your pore size, which is what we all want.
All right. Well, listen, thank you so much for joining us. We're going to go ahead and do this off the air. But we had a good time tonight. Thank you, Liz, and to Tara. So if you have any questions, please let us know. You can follow us on Facebook, Instagram, and Twitter, and join us at or visit us at bellissimoplasticsurgery.com. So next month we'll be back on March the 26th, another Tuesday evening, and we're going to talk about things to help you get ready for summer. Good night and thank you.